Hi, my name is Courtney Gibbs, and I will be completing my portfolio project through this video reflection. I tend to talk fast sometimes, and it causes me to stumble on my words, so just bear with me. I might kind of backtrack sometimes and kind of re-go over the information and re-go over some things I'm saying just to make sure that I'm understandable. Also, I tend to talk with my hands, so be prepared to see my little fingers just kind of doing their own thing. But anyway, so what I learned from this project was the importance of ethics in nursing and how certain ethical dilemmas such as end-of-life decision making can cause an enormous amount of stress onto the nurses. I did a lot of research and a lot of information gathering about this, and I found some really, really good resources just kind of detailing not only the definitions of what ethics is and how, it is applied in nursing and the obligations we have as nurses, but also about the stress related to end-of-life decision making and how detrimental it can be for nurses. And I also, most importantly, learned techniques and strategies that I can use as a nurse to kind of help alleviate or diminish some of these stress. And also how to provide a healthy environment, not only for myself as a nurse, but for my coworkers and most importantly for my patients. Because when we're stressed and if we're emotionally, mentally just not there, that can reflect poorly on our patient care, and that's just not what we want. So this project really covered a lot of the course outcomes that were stated in our syllabus, and it covered all of the institutional outcomes. For the course outcomes, this project showed that I was able to prepare a clear and concise computer-generated memo, proposal, letter. It also showed that I was able to assess, analyze, and synthesize my research through paraphrasing, through summarizing, and direct quoting, and in doing it in a manner that was clear, professional, and really showed that I had a good understanding of the information I was giving. It also demonstrated that I could deliver an oral presentation, obviously through doing this video reflection. For the institutional outcomes, it showed that I was able to use current technology and resources to locate and evaluate information needed to support my idea and my topic and to communicate it in a written form. By doing this reflection, I am meeting the thinking ability, and also just by picking a topic so relevant to my profession and picking such a topic that was so important to me, it met the community and career goal. The information and knowledge that I've gained through not only this project but throughout the class as well really aligns with the course's workplace capabilities. Some of the capabilities that were met through this were the interpersonal skills, the problem solving, the information literacy, and technology literacy. One additional one that I find most important that I was able to meet with the workplace capabilities was that of communication. The reason I feel this is so important is because communication is the center of nursing. There will not be a day that goes by that in some form I will not have to communicate with someone. Nurses are constantly communicating to the patients, to the families, between each other, to the doctors, to the administration, to even to furthermore into like politics and making legislation. And there's so many ways we can do this, you know, verbally, through this project. Like what this project stated or demonstrated was through written communication as well, through a memo or proposal. I think that this class and this project really better prepared me and gave me the tools I needed to succeed in this aspect and this capability as well. Overall, I really, really enjoyed this class, and I usually don't say that about English courses, but I feel the way that this class was set up and the way that the assignments were set up and with the project especially, it just made it the information more relatable and more easy for me to understand, and just easier for me to apply it in my real life. But yeah, so I think I've said enough and I've talked a lot and probably, yeah, but thank you so much for teaching me, and thank you so much for watching. Goodbye.